Hello, everyone. Mark here from Weedwell. Today, being Thursday, is our learning and knowledge session. This is a weekly thing that we do every Thursday at this time, 11 a.m. Eastern Standard Time. So, with that, it's my pleasure to have my colleague Paul Calori joining me today. And you're going to want to really stay with us for the duration. It's going to be packed with some very valuable information. And the topic this week has been your treatment plan in a circle of care. So there's going to be some really good information come out of today's session. And Paul, welcome.
Thanks, Mark. And we'll jump right in. We'll get right into the manifesto that I've assigned this week to this topic. And it goes like this. Doctors have my best interests in mind. Sometimes they seek alternatives because I have not responded to primary treatments. And so let's talk about this in the context of chronic medical conditions, which really fits the category of a lot of our listeners, a lot of our followers. And so with chronic medical conditions, by definition, they're long-standing issues. And so often the primary care provider tries to get whatever that is under control, and may or may not be able to, or certainly not to the degree where you're happy with it. And so often you'll get second opinions, and you'll be sent to specialists, people who really hone in on the area of pain or the mental health area that you're suffering from, and you go through what can be a lot of medical appointments. So we have numerous podcasts where clients, and these are success stories, but clients have shared this beginning stage, if you will, where they felt shuffled from doctor to doctor, specialist, a new medication, and whatnot, and really described a frustration. Episode 7, episode 8, episode 10, 12, or 13, all are patient stories, and this is kind of their beginning phase, the frustration of going from doctor to doctor, though the doctors are trying to work for you. And you can find those podcasts at podcast.weedwell.com. As I said, there's 5 to choose from, and they kind of all they're not the same story by any means, but if you take the summarizing point, this is how that fits into that manifesto, why I chose it today. From the patient point of view, that frustration, it melds into, is this as good as I'm going to get? Am I ever going to get better? Why can't I get better? If you have similar condition to someone else, or you've met along your treatment trail, which does happen, you wonder why they're getting better and you're not. So it all contributes to this frustration, sometimes even disillusionment when it's been going on for years upon years. So that's the manifesto kind of in your circle of care and how specialists go and that. And I think I want to bring this into the roadmap, and we're going to talk our way today through the entire roadmap. And we really tried to do that last week, I thought, quite successfully in how it applies to the different stages. So to take a half step back, we'll explain the roadmap first. There's 5 parts to it. What we call be clear, be aware, be informed, be progressing, and finally be well. And I know from your conversations through the week, Mark, you've touched on already the be clear, be aware, and be informed would have been yesterday. And we're going to relate our conversation to that. We're in the be progressing part, but a little bit about the steps, if you will. So each step, each of the 5 steps of this roadmap is designed to move you along your path to wellness, to get you from where you are today to some better point in the future. And each of these parts has 2 or 3 little baby steps, what we call milestones. And if you complete these milestones, inevitably, they help you get results and move you along your path to be well. We didn't just make this up. We have 6,000 patients that we've seen in a clinical setting over the years. A lot have been successful, not all of them have. But we share stories with them on what works. And of course, they're sharing stories with us. We take this knowledge and we've really broken it down into these 12 little steps, or 12 little milestones in 5 steps, to get you results. That's what it's all about. You're here today. You're unhappy, not satisfied in some way, and this roadmap will help you get to some greater level of satisfaction, some greater level of happiness and wellness. And that's kind of the roadmap. So we're in the 4th stage today, if you will, be progressing. And be progressing, we're going to call, or we're going to quantify with this statement. I have started my treatment with cannabis and begun to evaluate how it may help my chronic condition. I hope I can find relief and have access to the right product when needed. And that's kind of going to be our underlying statement with where you would be in your journey on this roadmap.
Mm-hmm. Good explanation there of all the various steps in the roadmap, and that identifying that today we are in the be progressing phase of that. So, Paul, I suspect that some might be wondering, the term circle of care might be new to them. So I'm just wondering if there would be a benefit in just elaborating a little bit on that and who is part of that circle of care, just to clarify that if there's any question out there.
So your circle of care, it's your team. It's the people working behind the scenes, your healthcare team. And it's, usually we get focused on the person we see once a week, once a month, or annually for our physical. But really that, when you look at it as a team, that circle grows quite a bit. And so, we're going to get into conversation here in the different sections of your pharmacist. Your pharmacist is a wealth of knowledge, and can be a huge part of your team. Your primary care practitioner is absolutely a huge part of your team. That person may refer you to specialists, consults, and that who then become part of your team. When we talk complementary and alternative medicines, in terms of, we'll see a lot of therapists in that, they become part of your team. And when you take your chronic medical condition, here, and your primary focus becomes that primary care practitioner, usually your family doctor. But when you start branching out, there's a lot of people that have their hands in that chronic medical condition. And of course, for those unfortunate enough to suffer from 2 or 3 chronic medical conditions, which in all honesty is not that uncommon, your circle becomes even more. You might have a circle for your kidney issues, a circle for your heart issues, like a cardiologist and that type of thing, and any number of other problems. So your circle can become bigger in that context. But your circle of care in general is your healthcare team. Any of those people who are working, direct with you or behind the scenes to really help that chronic condition or that medical condition that you're looking to treat.
Yes. So, Paul, the members of the team would be collaborating with other members of the team with one goal in mind, and that is the patient's safety, the patient's health and well-being. So, again, in an ideal world, each of those team members would be collaborating towards that common goal, right?
In a perfect world, yes. Ideally, that's exactly what happened, but or what would happen, excuse me. But what we do see is there's some shortfalls. We're going to talk about some of those today, in stuff that you can do as the client. The center of that, really, you're the center of that team. You're the glue that is holding it all together. And we're going to talk in terms of keeping people on the same page and that type of thing. So how about we just start and go there?
Sounds good. Dive in, because that's how I preface this week. We're going to dive deep into this topic.
Okay,
so it's time to dive.
One of, we talked milestones when I brought up the roadmap initially. One of the milestones, and this can be a lot of work for some people, is gaining clarity on your medications. And I bring this up in this context here because your pharmacist can be a huge source of knowledge with regards to that. And so not only can they give you the names, but you can have conversations with your pharmacist. If you're not sure, and there's no shame in this, ask why you're taking a medication and get a better answer than sometimes we actually hear this. The doctor told me to take this. He told me to take it twice, or she told me to take it twice a day. And well, you're introducing this to your body. You're expecting a result. You should know why you're taking it and what result you're looking for. And that's, as I said, a huge milestone for some to understand your medications. So your pharmacist is absolutely a part of your circle of care. Here's one of the downfalls. We talked with the pharmacist on one of the podcasts previously. What they don't see is if you go from one pharmacy to another, there can be some lost things there. So, if you deal with pharmacy A for 90% of your things, but you went to the hospital hypothetically and you used the hospital pharmacy for whatever prescription you were sent home with, there's not necessarily any communication that way. So the pharmacist that you deal with 90% of the time wouldn't know that you got this medication for so many days or what have you. So that is something where you would have to bridge the gap. And when the simplest way to do that is my medication record or getting clear on your medications, where you can keep a full list and you know what you're on. And as I said, more importantly, you know what you're trying to accomplish with these medications. So in the Be Clear sense, your pharmacist as part of your healthcare team is important. Now, let's relate it to cannabis. What we discovered and are discovering over time, pharmacists, either on their own learning or some pharmacies have taken an active role in the cannabis space, are understanding that with especially CBD, there's medication interactions. And this is exactly what they're trained to do. There's other things, but here's a key thing. If you're on medication A and you're on medication B and they mix badly, they let you know. And that's their street, if you will. And they know and they're trained to figure that out. So when that relates to cannabis, we're talking CBD and a specific liver pathway. And we do have a resource on that at weedwell.tips, and it's called Medications Metabolized in the Liver Affected by CBD. And so in terms of cannabis, they become more well-versed. If you're using CBD, you let them know, and it's like, no, you're on a blood thinner. You need to, and that's one of the reactions that you'll see. You're on a blood thinner. You need to consider that, or you need to talk to the prescribing doctor on what options there are, because that might be a bad mix.
Yeah. So, Paul, I'd like to springboard off of this because I think it's so important, and that is the role of a pharmacist in our healthcare. They're not just a pill counter in behind at the back end of the pharmacy. They have a wealth of knowledge. Schooling is 7 or plus years. So they are a specialist really in what they do. And they are there, most of them available for consultations as well. So I would encourage, any clients to take some time next time they're in their drugstore picking up a prescription to have a consult with the pharmacist. And it usually means just shifting over at the counter and requesting that. And in a relatively short period of time, the pharmacist will be there to answer your questions and maybe have your list of medication and go through that list. It's so important for all the reasons that you've already touched on. So I just want to encourage anyone listening to this or watching this today to take that step and really utilize in a professional sense, but the knowledge, the wealth of knowledge that these pharmacists do bring to the table.
Couldn't have said better myself, Mark. When I first introduced your pharmacist, it's the wealth of knowledge, and tap into that. And as I said, that's a fairly easy milestone that you can reach, just getting a handle on things. Really, if you focus on the what am I taking? Why am I taking? And what do I hope to accomplish by taking this? And as you pointed out, the pharmacist is going to be able to tell you kind of all three of those steps. Let's move on to be aware now and how it fits in, how the circle of care fits into there. So be aware. We're looking at the person with a chronic medical condition that has multiple practitioners. And so in terms of mental health issue, you have your primary care physician or a nurse practitioner. They may refer you to a psychiatrist or a psychologist for specific issues. In the case of pain, often we'll see people that have the primary care practitioner. They'll have a specialist for the source of pain. So let's say you have back issues. They're looking at how mechanically they can fix your back. You might be in a pain clinic. So these are the people in your healthcare team from that perspective. And what we want to bring up here is in, we'll say, medical appointment world, generally speaking, they talk very well to each other. And this is the idea of consult notes is what you'll hear, or referral notes. So family doctor says, hey, Mark, you need to go see Joe at this hospital, or Dr. Joe, excuse me, at this hospital, who's going to look at your back and see if surgery is an option. Mm-hmm. And so the note is sent one way to Dr. Joe. Dr. Joe sees you and say, you're not a surgery candidate, and sends a note back with all the findings that they had. So that's easy. Generally speaking, that's really well done from doctor to doctor or nurse practitioner, as the case may be. In cannabis world, it's hit and miss. So if your family doctor is your cannabis prescriber, you're golden. They'll know that you're on CBD. They'll talk strains with you. Generally speaking, if they're your prescriber, they have a handle on cannabinoids, THC, CBD specifically, but they have a handle on cannabinoids and how they'll work for you. And as I said, exactly the ones that you're taking. The issue or potential problem, we'll talk a little bit more about this as we go down our roadmap, but is when your primary care practitioner is not your prescriber. And so we have to bridge that gap. And that's, as I said, one of we'll say the holes in care, if you will, that we'll use the pain as the example. We know that you saw the surgeon, you're not a surgical candidate, but we don't know necessarily that you went to ABC Clinic and saw a cannabis clinician who prescribed to you this strain or that strain or this THC or that or whatever, but that doesn't necessarily get filtered back to your family doctor. It can be kind of a one-off on your own. You're doing something on the side. And what we really want, if there's a take-home message from this, is as much as possible to have all practitioners on board or on the same page, so everyone's pulling in the same direction for your care, for your chronic medical condition. And so, as I say, I highlight in Be Aware, this is a potential for a gap when you use a different clinic or a different physician or practitioner for your medical cannabis needs.
Yes, Paul. And as you would know, at the clinic, we've always been advocates and encouraging to do that whenever possible. And we know that sometimes there's obstacles that get in the way, and it's not an ideal situation for the client to do that. But for all the reasons that you've already mentioned, why it is they're best suited to do that, if that is at all possible. But if not, to bridge that gap and report back to your doctor, just saying, just so you know, I'm under the care of, a group at a clinic that really understand cannabinoids, but I wanted to keep you in the loop to do that. So two things, this will benefit you as a client and the relationship with your primary care provider, but you're also going to some degree perhaps even increase the level of knowledge towards cannabis with that doctor. And that could help you, but also help other patients that have and see the same doctor for their primary care as well. So it's a win-win situation. And again, it's about taking ownership. And as a client, as a patient to a given practitioner, it is really your responsibility to bring that feedback to the doctor. And if you are feeling positive results or non-positive, to feed that back as well, to really tighten the relationship between the patient and doctor relationship, because that's how you're going to get the best out of your care.
Excellent and well said. I will use that to springboard into Be Informed, to piggyback off what you've just said. So, Be Informed now, kind of the area where we're talking cannabinoids and introducing cannabis. So, as part of the roadmap, it's not until the third step where we really talk about this. And so, the idea from here and how it relates in your circle of care is as you begin to introduce cannabis, try to understand how the cannabinoids are helping you. So I find that CBD in the morning and afternoon really tempers my anxiety. And by the time evening comes, I feel I'm much more relaxed and I'm sleeping well. So that would be a good description on how it's working for you. I find the THC does, and whatever the case may be, and this relates to not only cannabinoids but methods of consumption as well. We've talked in those podcasts previously, people who really gravitated towards an inhalation method that worked really well for one particular client was migraines, and we've talked to other people that didn't want to inhale. They were either ex-smokers or just didn't want to inhale and worry about their lungs, and they gravitated towards the sublingual or edible dosing with great success as well. And so as you figure out the cannabinoid you want and how you take it, this is all information in your head. And you know what? Some don't work well. And so, take note of that too. And that's really kind of your Be Informed discussion insofar as cannabinoids and methods of consumption goes and how it might relate to your circle of care. You're muted, Mark.
Excellent, Paul. You're on a roll.
Okay, I'll continue then. So This is now, really where we're at today, Be Progressing. And where this fits in is really from the Be Informed. Now, if you have a great memory, great. Store that up there, all that information I just said about the being informed and the idea of this cannabinoid works and this didn't and this side effect happened, or I use this method of consumption. But if you don't have that memory, journal it. And journaling is one of the big milestones in understanding what it's for and how it works in Be Progressing. Another of the milestones in Be Progressing, though, is how to talk to your doc. So first off, let's do the what, if you will. So you've done all that knowledge attaining, if you will, understanding the cannabinoids, the methods of consumption. One of the things you want to do is relate what works and what doesn't work from that wealth of knowledge to your doc. And this is in the case if you're medicating on your own or you've gone to that cannabis clinic, got your prescription and you're medicating with a doctor. And so you can start your conversation, as you said, you want to keep everyone in the same loop with what has worked and what hasn't worked. Along with that, though, you want to bring up previous treatments when you're talking with your doctor. And so quite often, the two medications or the two types of medications that I can recall from a clinical setting that people want to discontinue for any number of reasons are antidepressants and those kind of, we'll call that group of medicines, and pain pills. And so a lot of times it's the side effects in the antidepressants that we hear about. And a lot of times in the pain pills, so I'm saying opiates really, but the pain pills is I'm taking more and more to achieve just the same results. and then my body gets used to that. I have to take more and more just to get back to the same results. Over time, that's not working for me anymore because I'm just taking more and more. And so when you relate those types of things that didn't work along with a cannabinoid or a method of consumption that does work, now you kind of have, we'll say, a more holistic conversation with the doctor, because you're giving kind of, at least from a personal standpoint, evidence. I'll talk a little bit more about evidence in a second, but at least anecdotally, what works for you, you're able to relate that in a clear way. This symptom was helped, this symptom wasn't helped. When I was on the antidepressant, this happened. And you kind of get a clear story of kind of why you're gravitating towards, we'll say, a cannabis route versus a non-cannabis route for, lack of a better description.
So, Paul, what I'm hearing from you is really the responsibility of the client or the patient is to become an advocate for their own health and their well-being,
Yep.
and take an active role in that, and not just to go see treating specialists or your family doctor and expect them to have all the answers. It is your role and your responsibility to really do your due diligence, if you like, and to and journal, as you've already touched on, and then report this back to the healthcare provider. And I will say with some degree of confidence that when you're sitting in front of a healthcare practitioner, that if you come equipped and prepared and you have some notes, I believe you're going to get a lot more value out of your 10, 12 minutes in front of that practitioner, for a number of reasons. First of all, they're going to see that you are serious about your health. You're taking an active role and interest in your health, and you come prepared. And you're able to answer the questions that the practitioner may raise while you're there because you have your notes. So that's encouraging for the practitioner to work with someone like that. And you're going to get a lot more value out of your time, and consequently a lot more results when you leave there and be better equipped, for your next steps.
Along with helping yourself, and this was an important point I left alone, I think when you were talking at the end of when we did Be Aware, is you potentially help out other people. And that is, the doctor hears one story from you on how it works, and they may forget about it because they saw 32 patients today, but they heard another one tomorrow, 2 more on Thursday, and so on and so forth. Eventually that sinks into what's going on here. There might be something to it. However, the truth is not every doctor is going to hear what you're saying. At the very least, though, you've disclosed what you're using, and they can take that knowledge as part of your care team how they want. But you've disclosed that, you've been transparent, and you've explained how it's working, why it's working, etc. Now, I'll just give the doctor's point of view. At least we can present that point of view as to why they might shut the conversation down. There are a number of physicians that would be licensed to practice that, given their age and when the discovery of the endocannabinoid system occurred, they wouldn't have learned that in medical school. And so there's just a lack of knowledge base because it didn't exist 30 years ago. So that's going to be a problem. And what that's going to create is some knowledge gaps. So really what that refers to is what the physician knows versus what they would like to know. And then just think of anything, physicians are humans too. What it becomes is, where do I start? Because this is a giant topic. The medical school directed me through the kidney study, directed me through the heart study, directed me through this study and that study. I kind of have to do this a little bit on my own. Where do I start? And that can be overwhelming. Just to be fair to the physician, where do you start? And then, one of the big ones where they can get dismissive is evidence. And I talked about this with the Be Informed discussion. So you'll have the evidence on how it works for yourself. What you won't find in many, many medical conditions is anything beyond, we'll say, strong anecdotal evidence. There's very, very few conditions that have gone through, we'll say, FDA approved studies, double blind studies. A lot of what you'll see in supporting cannabis for this condition or that condition are retroactive studies or loads of people in small cohorts of studies that say, yeah, cannabis helped with my migraine or cannabis helped with my anxiety. And they're very, we'll say, what the scientific community would call not high quality studies. And so it becomes hard for a physician based on that strength of evidence to, we'll say, prescribe the CBD or prescribe the THC.
Yeah, excellent, Paul.
Okay, I'll keep going. I'm on a roll.
You've said it all. You've said it all. Very well said, by the way. Yeah.
Okay, so be well now, and so as we've gone through all this, we start looking and we've had conversations about this in terms of complementary and alternative medicines. And, I mentioned during that conversation, at this point in time, given what I just said about doctors, cannabis to some degree is a complementary medicine or an alternative medicine. And that just goes to how you're using it. And so, in the idea of medication substitution, I want to get off the pain pills, the antidepressants, really you're using cannabis in an alternative fashion. But often we see clients use it in a complementary fashion in terms of it helps with my time with the psychiatrist. It helps with my time with the chiropractor or physiotherapist, and I can do the exercises and stuff like that. But they're part of your care team too. And so you want, again, we're all inclusive. In an ideal situation, so we're all pulling in the same direction. We all understand the things that you're putting into your body, so to speak, and so we keep everyone on the same page. And so that's really in the Be Well sense where we're looking to include your circle of care to your, we'll say, extended healthcare providers. You want me to keep going?
Don't stop, a good thing.
Okay. So, really that's your run through our B stages, if you will, in terms of your circle of care and how they might play into your health care, your treatment of your chronic condition. And so, if I summarize, I'll give some big take-home points. Your pharmacist is becoming more and more knowledgeable. Not everyone, but in general, more and more knowledgeable because, some of the major chain pharmacies have taken a front role in terms of cannabis. And so they're much more able to talk about it in general, CBD, THC. But especially from a safety point of view, you don't want to mix this medicine with CBD or what have you. So, that's in terms of safety and a be clear. In general, your circle of care or your health care team is anyone providing care for your chronic medical conditions. And if you have multiple, you'll have many, many practitioners. We're just saying try to keep them all on the same page. There's usually good communication from practitioner to practitioner. Unfortunately, outside in the cannabis world or in the cannabis space, if you see a doctor or a practitioner in that space, it's not necessarily that they're communicating back to the people that need to know. Try to close that loop where you see the gaps to help ensure everyone's pulling in your direction, because in the end, it's your safety, it's your care, it's your body, it's your health, it's your wellness.
Paul, to springboard off of that, there's really one good example. There are many, but this one really stands out, one that you're familiar with. You've touched on briefly interaction between medication and how your pharmacist really is a good source to be able to help clarify that. But again, the benefit of the collaboration between each team member in your center of care group is so significant. And Paul, I know you'll recall this story quite well, where this lady in her late 70s was considering CBD for her inflammation and arthritis condition that she was struggling with. And a colleague had mentioned to her that, hey, it's working for them. So anyways, all this to say that there was it was discovered with the pharmacist and the doctor that there was interaction between CBD and a medication that she was using to prevent breast cancer from reoccurring. And by adding CBD to the treatment plan, basically nullified the effects of that and increased significantly the risks and potential of her having breast cancer yet again. So that is why it is so important to have each team member informed, kept in the loop. And the benefit with this year was that between the pharmacist, the treating physician, and the oncologist, together they were able to find a substitute for the breast cancer medication that would allow her, the client or the patient in this case, to be able to introduce CBD in as well. So I like the story because it really drives the point home of the benefits of the healthcare team, the circle of care people working together collaboratively with that common goal. And that one really says it all.
For sure. If anything that you glean from that, it's the safety perspective, and despite best efforts, if someone in your healthcare team is doing something that may benefit you, but isn't aware of two or three things someone else did, this is where the potential for hazards occur. And luckily, everyone was kind of on the same page in this instance, and it didn't occur. So,
So Paul, anything else? You've covered a lot of ground today. Is there anything else in your bag of knowledge and wisdom to share with our group today?
No, I'll just wrap up. I'll talk a little bit about next week, and we're just going to focus on, again, in terms of the roadmap, trying to find out what's my right dose. How do I figure that out? How do I go about that? We're talking in terms of cannabis. What's my right dose, and how do I go about finding that? And I look forward to discussing that with you next week.
I look forward to that as well. It's, they're all great topics. I particularly like that one there. There's a lot of benefits to be derived from that. So as Paul was saying, the topic next Thursday is how to find your right cannabis dose. So I look forward to that. Paul, as always, it's been a pleasure. And now I'll take over and I'll do my wrap up and my disclosure. So, as I said, my wrap up and disclosure, here it is. I'd like to remind our audience that these information sessions are intended for individuals who are generally in good health, are generally well adjusted, and are functioning effectively. And they're not in need of medical treatment. And that includes treatment for medical health disorders. Now, these information sessions do not involve the diagnosis or treatment of any medical or mental disorders and do not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. Now, for those of you who have taken some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of my colleagues, Doug, Paul, and myself, we enjoy these sessions, and we look forward to the next time that we connect. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.